Have you ever wondered how doctors get a clear picture of what is happening inside your body, especially when it comes to something as vital as your bladder? It is a complex organ, and sometimes symptoms can be a bit of a mystery. Bladder imaging is typically recommended when you experience persistent or concerning urinary symptoms that requiring a detailed look beyond what a physical exam or basic urine test can reveal. It is a crucial step in understanding the root cause of your discomfort or potential issues. The main reasons doctors suggest bladder imaging are to investigate symptoms like recurrent urinary tract infections, blood in your urine, persistent pain in the lower abdomen or pelvis, or unexplained changes in bladder habits, such as frequent urination or difficulty emptying your bladder completely. Imaging helps identify structural abnormalities, blockages, stones, or even growths within the bladder or nearby structures. For instance, if there is suspicion of a kidney stone causing issues down the urinary tract, or if a doctor needs to assess the extent of bladder wall thickening, imaging provides invaluable diagnostic information. It allows medical professionals to visualize the internal anatomy and function, distinguishing between different potential conditions. This detailed view is essential for an accurate diagnosis and for planning the most effective course of treatment. Your doctor will consider your specific symptoms, medical history, and any initial test results to determine if bladder imaging is necessary and which type would be most appropriate. This often involves a conversation about your experiences and a careful evaluation. They might choose an ultrasound first, which is non-invasive, or suggest more advanced tests like a CT scan or MRI if there is a need for greater detail, especially to evaluate for conditions like bladder cancer or complex structural issues. Sometimes, a cystogram, which uses dye to visualize the bladder, might be recommended to check for reflux or leakage. Beyond just identifying problems, these imaging techniques can also help monitor known conditions or assess the effectiveness of ongoing treatments. For example, a computed tomography scan, known as a CT scan, provides cross-sectional images that can detect tumors, kidney stones, or other blockages with high precision. Understanding when bladder imaging is recommended empowers you to have informed conversations with your healthcare provider. Early and accurate diagnosis through imaging is key to effective management, helping to ensure your bladder health and overall well-being.